questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you very much, Mr. Speaker. My question is for the Premier. We have heard time and time again of the troubles facing our long-term care system and its patients. My colleagues from the NDP have spoken at length about the need for more beds, and more beds are desperately needed. But the system today struggles to adequately care for the patients already in long-term care due to shortage of trained staff. My colleague from Northside Westmount spoke yesterday of patients who are only taken out of bed every other day, and nurses in Nova Scotia are now speaking up too about this. Their stories are equally disappointing. So does the Premier believe that the current staffing levels at Nova Scotia's long-term care facilities are sufficient to provide adequate patient care?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for the question. I believe what the Nurses Union talked about is the level of care that has changed, Mr. Speaker, over a period of time, causing us to have a look at what's happening in long-term care facilities, why we appointed the expert panel, Mr. Speaker, who will come back and bring us recommendations.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. The stories are difficult for anyone who has a family member in care or who may soon be there themselves. Stories of soiled linens that are too long in changing, stories of patients who can't get a hot meal because staff simply cannot feed everyone fast enough. Right now, RNs can be responsible for up to 120 patients, each with LPNs responsible for 30 and CCAs responsible for 4 to 6 patients each time. So I will table that stats. What does the Premier see as the ideal staff-to-patient ratio, and what is his government going to do to ensure that level is reached?
The Honourable Premier.
Mr. Speaker, again, I want to thank the Honourable for the question. Mr. Speaker, that's why we put together an expert panel to bring us back recommendations, Mr. Speaker, how we continue to improve long-term care and facility across the province, Mr. Speaker.
The Honourable Leader of the Official Opposition.
We have heard time and time again, Mr. Speaker, of the troubles facing our long-term care system and its patients. Oh, excuse me. The demands on the system are greater than what the system is actually built to handle, and the demographics all point to the demands steadily increasing over the next few decades. Keeping seniors in their homes longer is a great idea, but it only serves to delay and make more acute the services provided by long-term care. New buildings, yes. Beds, yes, but increases in trained, qualified personnel should be first. Is the Premier satisfied that the long-term care system has the resources needed to adapt to the changing demands of its patients?
The Honourable Premier.
Thank you, Mr. Speaker. In the preamble leading into her question, Mr. Speaker, she's absolutely right. People want to be home longer. It's why we continue to invest in long-term care or in home care, Mr. Speaker. She's also right, Mr. Speaker. That means sometimes when people enter into a long-term care facility, the acuity need is much higher than it would have been otherwise. But that's a combination of ensuring that people be able to stay at home as long as possible, and when they really need to be transitioned to long-term care, that we have the infrastructure there to be able to ensure that we provide that service. Is why we announced an additional 50 long-term care beds in Cape Breton. We're looking across the province. Where can we make those strategic investments to deal with some of the wait lists that, by the way, has been reduced by 50% since we've come into power? And we're looking forward to this expert panel that will bring us back other recommendations how we continue to work with our partners to provide the care that our loved ones deserve.
The Honourable Leader of the New Democratic Party.
The world is talking this week about climate change in the wake of the report released by the United Nations Intergovernmental Panel, report which makes clear that what it calls rapid and far-reaching measures are going to be needed from governments to limit dramatic climate impacts. But here in Nova Scotia, what we get instead is today a decision to use recycling money to subsidize Lafarge cement to burn tires. Now, the government can call this a green initiative until they turn green themselves, but the fact is that the project that increases emissions from quarrying and that releases toxins and that undermines recycling is an environmentally regressive thing. Can the Premier point to any analysis that says that this tire burning project will reduce overall emissions for the province and not just the emissions at Lafarge?
The Honourable Premier.
Well, Mr. Speaker, if we reduce emissions at Lafarge, we would reduce them overall across the province, Mr. Speaker. They are part of the issue, part of our province, Mr. Speaker. But the reality of it is this process went through a permitting process. They have a pilot, Mr. Speaker, to move forward. We'll continue to monitor it as they continue to, Mr. Speaker, to do a practice that not only is being done in not only be done here in terms of how we divert tires, but it's being done in other Canadian provinces as well.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, the government is missing the mark by so many miles. This week, the United Nations report makes so clear the whole world has got to be near net zero emissions by 2050. We can't afford to be subsidizing toxic projects like tire burning. We need ambitious reduction emissions targets, and we need regulatory decisions to get us to those targets. Precisely a target of this sort has been placed before us in Nova Scotia with the 2030 declaration. So here's the question for the Premier. Will he commit to a target of reducing our emissions to 50% below 1990 levels by 2030?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member of the question. This is one of those issues, Mr. Speaker, in our province that all three political parties can take credit working together as we collectively since 2008, I believe it was, when Minister Perrant brought it into the House. We all agreed. And even though successive times government has changed, parties have changed who sits on this side of the House, we continue to move forward to ensure, Mr. Speaker, that we continue down the road of reducing greenhouse gas in our province. Now, Honourable Member would know that we are already at the 2030 targets that were set by 2025. We will continue. We'll continue, Mr. Speaker, to make the investments and ensure that we continue to reduce our greenhouse gases and continue to improve the environment that we live in, Mr. Speaker.
The Honourable Leader of the New Democratic Party.
The Premier has said earlier that the emissions reduction target in his cap-and-trade program will be in the area of 50% below 2005 levels by 2030. I'll table his comments to that effect. But this is a level that is not a bit lower than current projections for 2030 without there being any cap-and-trade program. I want to ask the Premier, in what world is it now acceptable that the impact of cap-and-trade on projected emissions by 2030 will be zero?
Right.
The Honourable Premier.
Mr. Speaker, again, as I said in my first answer, Mr. Speaker, through successive governments, we continue down the same path of reducing our greenhouse gas, Mr. Speaker, in the province, continuing to lead the country in that endeavour, Mr. Speaker. We'll continue to do so. We'll continue to make changes. The issues that we're doing in and around ensuring that individuals reduce their own footprint by the housing grant programs that we have. They continue to make those investments, continue to ensure that we green the power grid within this province. At the same time, Mr. Speaker, continuing to make sure that we have the capacity to grow the economy of this province and allow the fact that we can have economic growth at the same time that we're protecting the environment, Mr. Speaker. The Honourable Member wants to lead us down the path, Mr. Speaker, that does not involve a growing economy. We want to do both.
The Honourable Leader of the Official Opposition.
Thank you very much, Mr. Speaker. My question is for the Premier. In the spring, Bill 108, the Cannabis Control Act, passed through this House. Part of the bill said that the Governor and Council can make regulations to do things such as define what a private dwelling is, establish rules around the cultivation of cannabis and transporting cannabis. With legalization just a week away, the implementation of these should be clear to Nova Scotians, but they're not. As of 4:30 yesterday, there were no regulations passed for Bill 108. Why not?
The Honourable Premier.
Mr. Speaker, I'll ask the Minister of Justice to respond.
The Honourable Minister of Justice.
Thank you, Mr. Speaker. The point that my colleague makes is a continuation of the legalization of recreational cannabis in Nova Scotia, Mr. Speaker. All of the important elements and essential elements of legislation for the province were completed yesterday with the Nova Scotia Liquor Corporation announcement of the online opportunities for purchase. We're very satisfied, Mr. Speaker, and very comfortable with where Nova Scotia has landed in legislation around the legalization of recreational cannabis.
The Honourable Leader of the Official Opposition.
Thank you very much. I'll direct this question to the Premier or the Minister of Justice. For some time, we have worried that this government is not ready for the legalization of recreational cannabis. The fact that regulations regarding cannabis control have been left to the 11th hour, and it doesn't make us less worried. In fact, it creates a lot of anxiety for parents, teachers, health professionals, and so on, law enforcement. If there are rules around such things as transporting cannabis and growing cannabis, Nova Scotians and law enforcement need to know more than just a week's notice. So as the Minister indicated yesterday, there were some regulations made online, but what other means are you going to get the information out there? How are you rolling it out to parents and health professionals?
I'd like to remind the honourable member to keep her questions directed through the chair. The Honourable Minister of Justice.
Thank you, Mr. Speaker, and I appreciate my colleague's question because it does give me an opportunity to further share with Nova Scotians and members of this legislature the practices that are in place. My colleague would know, Mr. Speaker, we have undertaken a very thorough and exhaustive education and awareness campaign that is seen over multiple streams, Mr. Speaker. It is communicating, Mr. Speaker, to the public at large the status of legalization of recreational cannabis in Nova Scotia. And the Nova Scotia/cannabis website, Mr. Speaker, is the most thorough and detailed website in the country as we speak, Mr. Speaker, that talks about the very points my colleague has identified, Mr. Speaker. So it's important, Mr. Speaker, that my colleague, all of our colleagues in this House and all Nova Scotians take the opportunity to access the website and clearly look, Mr. Speaker, at the program that Nova Scotia has implemented, Mr. Speaker. We're very proud of the work we've done.
The Honourable Leader of the New Democratic Party.
My question is for the Premier. A series of Auditors General over a succession of decades have been reviewing and looking at this question of P3 projects in Nova Scotia. In '97, the Auditor General issued a report critical of the P3 arrangement about the 39 schools. In '98, the AG criticized the government's failure to effectively compare costs of the schools between P3s or the public sector. In 2010, the Auditor General issued a report critical of the government's failure to exercise a duty of care about the P3 schools. Mr. Speaker, why, in choosing now a mode of hospital development, has the Premier chosen to ignore 21 years of work from the Auditors General of Nova Scotia?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the honourable member for the question. If you go back and look at those continued reports, Auditor Generals have made recommendations on how we continue to improve P3 models. There are very different models being used in different parts of the country, Mr. Speaker. As I said to him earlier, we believe this is the appropriate path forward when it comes to the redevelopment of the QE2 here in the peninsula, Mr. Speaker, ensuring that we have a modern healthcare system that reflects the needs of today and the realities of 50 years from now. We're going to continue down this path of working with our private sector to ensure that that infrastructure is in place. I also want to say to the honourable member, I was pleased to be able to support his government's decision on the P3 model they chose when it came to the Nova Centre. I want to continue to congratulate his party for adopting the P3 model, and we're going to continue to make sure that we provide those infrastructure for our citizens.
The Honourable Leader of the New Democratic Party.
Evidence still counts, Mr. Speaker, for something. The New Brunswick Auditor General reviewed the decision of the government in that province to build 2 P3 schools, and he found that the government spent $1.7 million more than they would have with a normal building method. And the Ontario Auditor General reported that P3 projects cost the province $8 billion more than if the projects had been built by that province. In BC, the Auditor General found the government was paying nearly twice as much for borrowing through P3s as it would have had it borrowed the money itself. Mr. Speaker, why should the public of Nova Scotia believe the government's single lone secret Deloitte report when there is a whole country full of Auditors General who have come to the opposite conclusion?
The Honourable Premier.
Thank you, Mr. Speaker. Again, I want to thank the honourable member for the question. We're continuing to look forward as we continue to roll out, Mr. Speaker, our P3 option to deliver primary health care here in the capital region, Mr. Speaker, that will provide services to citizens across our province. We believe this is the appropriate model. We will continue to do the due diligence we've had, Mr. Speaker, since I made this announcement in 2016, following through for the next 12 months to ensure that we have a contract, Mr. Speaker, with a developer that is tight, one that will deliver on what the commitments that our healthcare providers are telling us are required to ensure that we can deliver that. Mr. Speaker, we will expect our contractor to deliver this project on time and on budget, Mr. Speaker. The honourable member, when he's referring to what's happening in the Canadian province, is ignoring the fact that in this very own province, Mr. Speaker, when a former government announced a hospital in Truro for $90-some million, it was more than double by the time it went through, Mr. Speaker. The Auditor General continued to have a comment about those, continue to say that, Mr. Speaker. We're going to continue to make sure that when we put together infrastructure, Mr. Speaker, it is exactly what we want. It's exactly what Nova Scotians expect. It's exactly, Mr. Speaker, what the healthcare providers want to work in, and we're going to continue to do so with our partners.
The honourable member for Pictou Centre.
Mr. Speaker, my question is for the Minister of Justice. Over the summer, the federal government signalled that it intended to approve the Drager 5000 device to aid in the detection of persons under the influence of cannabis. The Drager 5000 is intended to be a roadside device that is capable of analyzing saliva and determining the intoxication of a subject from either cannabis or cocaine. There are reports from StatScan that would suggest that almost 53% of Nova Scotians are driving high every day. The need to provide police with effective tools are clear. My question to the Minister, does the Minister of Justice know how many Drager 5000 devices are in use in Nova Scotia, and is there a plan to expand that number?
The Honourable Minister of Justice.
Thank you, Mr. Speaker. Thank my colleague for the question. The Drager technology that my colleague is speaking about, Mr. Speaker, is new technology, as my colleague indicated, announced by the federal government just recently. That product is being made available across the country to police agencies, law enforcement agencies who choose to use that as a tool in the fight against impaired driving by drugs. And we leave the decision of the purchase of those to our law enforcement community who are leading in the area of impaired driving enforcement.
The honourable member for Pictou Centre.
Mr. Speaker, unfortunately, the latest data shows that the Drager 5000 may not be an effective tool for such detection. It is reported in the Journal of Analytical Toxicology that the Drager has a false positive rate of 14.5%. That is 14.5% of the time the device will say that a driver is impaired when they are not. More disturbing, the device has a false negative rate of 13.5%, which means 13.5% of the time an impaired driver will not be caught. Moreover, the device becomes less accurate in cold weather. Imagine the problems these figures could cause when put before a judge. Question to the Minister, has the Minister taken steps to mitigate the potential problems arising from the questionable results of these devices?
The Honourable Minister of Justice.
Thank you, Mr. Speaker. And the instrument that my colleague refers to harkens back to my use, Mr. Speaker, of the breathalyzer as it relates to alcohol and impaired driving. But what I think is most important for my colleague and all of us in the House to know and Nova Scotians to know, Nova Scotia is leading the country in the standard field sobriety tests and drug recognition expert training. Number of law enforcement officers in the province, Mr. Speaker. We have the highest number of drug recognition experts in our law enforcement community compared to any other province in the country. What Nova Scotia has done, Mr. Speaker, is they have taken the leadership role, and I will say to my colleagues, over multiple governments, Mr. Speaker, to ensure that Nova Scotians and road safety is a priority. We will continue with that in mind, Mr. Speaker. We will continue to expand the number of drug recognition expert trained officers to ensure that Nova Scotians are safe on our highways.
The honourable member for Cumberland South.
Thank you, Mr. Speaker. Mr. Speaker, my question is to the Minister responsible for Nova Scotia Liquor Corp. This government has decided to only offer cannabis for sale in a handful of municipalities across this province. This leaves many people in rural Nova Scotia unable to easily access cannabis. For some, the nearest physical location is located over 60 minutes away. The solution for this, according to this government, is home delivery for online sales. Despite recent announcements regarding rural internet, online purchasing is simply not foreseeable in the future for many Nova Scotians. For those in rural areas without reliable internet access, how does the minister propose access to cannabis?
The Honourable Minister of Justice.
Thank you, Mr. Speaker, and I thank my colleague for the question. We've had this discussion in the legislature on a number of occasions, and we've spoken publicly, Mr. Speaker, to the availability of recreational cannabis in the province of Nova Scotia. We initially announced 9 stores, Mr. Speaker, based on the July 1st start date. The Nova Scotia Liquor Corporation, being as diligent and professional as they have, reviewed the number of stores when the federal government announced an October 17th date. The Nova Scotia Liquor Corporation, Mr. Speaker, was able to add an additional 3 stores. In addition to that, Mr. Speaker, we have the online model that was announced yesterday. This online model will ensure that all Nova Scotians, regardless of where they live, have access to recreational cannabis. And I will tell my colleague as well that every liquor store in the province will be able to provide the barcode system that Nova Scotians will come to rely on for their access, particularly in those rural communities across the province.
The honourable member for Cumberland South.
Mr. Speaker, I thank the minister for the response, but it still begs the point that many Nova Scotians still do not have access to internet. Most regular cannabis users in rural Nova Scotia will not drive 60 minutes for their pot, nor will they wait for an online purchase to be delivered. They're most likely going to continue to access the black or grey markets for their cannabis. The NSLC business plan states that on one of its priorities, provide a safe supply of cannabis to Nova Scotia to help eliminate the illicit market. But this distribution model will not work. Does the minister anticipate the poor access to legal cannabis in rural Nova Scotia will still allow the illegal market to grow?
The Honourable Minister of Justice.
Thank you, Mr. Speaker. I've spoken publicly as well, Mr. Speaker, about the transition from the illicit market to the legal market, Mr. Speaker. We know there's no switch that's going to be flipped on the 17th of October, that people are going to transition to the legal market. We use Colorado, Mr. Speaker, as the example. Colorado has done their research, and over the period of 3 years, they've seen a 75% transition from the illicit market to the legal market. We will monitor, Mr. Speaker, over the next number of months what we see that transition to be. But I have to tell my colleague as well, the last significant weather storm we had in this province in 2014, when Nova Scotians looked for food and water in our community stations around the province, their first ask, Mr. Speaker, in coming into those facilities, how and where can I charge my device? Nova Scotians have access, Mr. Speaker. We will continue to work on the Internet project. My colleague in the Department of Business, Mr. Speaker, $190 million committed to that project. We are confident, Mr. Speaker, recreational cannabis will be available to Nova Scotians.
The honourable member for Sydney River Myra Lewisburg.
Thank you very much, Mr. Speaker. And Mr. Speaker, my question to you, through you, is to the Minister of TIR. In July, this government announced that because the departments of TIR and Health and Wellness didn't have the expertise, a new division of Nova Scotia Lands would be given $6 million annually to deliver both the Queen E2 development and the hospital redevelopment in Cape Breton Regional Municipality. In this week's announcement on the QE2 project, there was no mention of Nova Scotia Lands, only that there would be P3 project would be costing upwards of $2 billion. In fact, there's no mention of Nova Scotia Lands anywhere on the government's Queen E2 redevelopment website. So my question, Mr. Speaker, is why did the government announce $6 million a year for a new Crown Corporation division and then neglect to mention it in last week's fanfare?
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker, and thank the member opposite for the question. Nova Scotia Lands is hardly new, Mr. Speaker. One of its great triumphs was the reclamation and constitution of the so-called tar ponds in Sydney, which has been a tremendous success and shows the usefulness of that particular corporation in terms of being able to come in and do these redevelopments. In terms of Nova Scotia Land's role in the redevelopment of QE2 or the Cape Breton initiative, which is certainly being contemplated by the department, remains to be seen just exactly what they'll be doing in that instance.
The honourable member for Sydney River Myra Lewisburg.
Well, Mr. Speaker, I'm well aware of the great work that the people at Nova Scotia Lands do, but it was his government that announced that there was a special department going to be developed to do the kind of work I just mentioned. I don't know. Now, the government loves to announce and re-announce spending as much as possible, but I wonder if something got lost in last week's fanfare. The minister and I both know that Nova Scotians need doctors, and they need the infrastructure for those doctors and other medical staff to help keep Nova Scotians healthy. But it doesn't help anyone to keep things like costs and process in the dark. Government has already refused to release the report that led them to their Queen E2 redevelopment model. And now I wonder if they're playing another shell game with Nova Scotia Land. So again, to the minister, can you assure this House that all the funding delivered to the Health Capital Delivery Branch of Nova Scotia Lands will be subject to transparency and public scrutiny?
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker. I really thank the member opposite for the question, because we've reached a turning point here in this reality. This government announced that we are going to rebuild the infrastructure in Cape Breton to health infrastructure, and up until this point, it was being treated as if it was a fantasy. Now I see the reality is sinking in, and it's so good to see the member recognize that in the very short time, the health system, the structures in Cape Breton will be rebuilt with significant increase in long-term care beds and at 2 collaborative centres that will be the envy of Nova Scotia.
The honourable member for Cape Breton Centre.
Envy. Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Health. Nursing homes in Nova Scotia need to be adequately staffed in order for vulnerable seniors to get the care they need and deserve. This government's cuts to nursing home budgets means facilities are trying to do more with less. Jane Meadus, a lawyer at the Toronto-based Advocacy Centre for the Elderly, says there is an indifference towards seniors and care that would not be accepted in other facilities. She says that the attitude is, and I quote, "This is just the way it is, and this is what we have to put up with," and I'll table that. Mr. Speaker, does the minister think it is acceptable that seniors in nursing homes can't even get a hot meal because by the time the CCA gets to them, their meal is cold?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And in fact, I don't agree with the assessment that the member cited of this individual from Toronto. Perhaps that's the way that individual sees the viewpoint in her jurisdiction. But, Mr. Speaker, we do take the concerns on the quality of care in our long-term care centres very seriously, Mr. Speaker. These are our parents and grandparents in these facilities. That's why we appointed an expert panel, Mr. Speaker. The 3 individuals there have impeccable records in their research and their clinical experiences. Look forward to getting the recommendations from them so that we can then move forward, Mr. Speaker, on improving quality of care in long-term care in Nova Scotia.
The Honourable Member for Cape Breton Centre.
Mr. Speaker, one of the consequences of seniors staying at home longer is that they are more frail when they're placed in long-term care. A recent media report quotes the president of the Nova Scotia Nurses Union, and she says, "Most of our residents are incontinent. Many of them cannot walk or need assistance to walk. The majority of them need help to bathe. Half or more need some help feeding." The requirement for those seniors has escalated and the funding hasn't changed. And Mr. Speaker, I brought that example from a Glace Bay family in long-term care in Glace Bay, that the resident needs to call her daughter 50 kilometres away to tell her that she needs to pee or that she's fallen. We know the addition of more beds. We need time for those providing care with residents to ensure valuable seniors are safe and happy and healthy. Mr. Speaker, will the minister agree to increase funding to ensure adequate staffing levels are available in nursing homes?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As noted previously, we do take the concerns very seriously. That's why we not only appointed the panel, but, Mr. Speaker, we didn't wait just for establishing a panel to provide feedback. We've been taking action on recommendations that have come in previously. We've been investing in equipment and technology. We've increased funding for food and recreation budgets, Mr. Speaker, based upon feedback. But we do, Mr. Speaker, believe that the recommendations that are going to come forward will be positive for the care of seniors in our long-term care facilities, or residents, Mr. Speaker, of our long-term care facilities throughout the province. I look forward to receiving those recommendations and then being able to move forward on them.
The Honourable Member for Pictou Centre.
Mr. Speaker, my question is to the Minister responsible for EMO. In 2014, I received an assessment from an anonymous expert concerning the rail lines running through my constituency. After viewing the rail system through the New Glasgow downtown core, I felt an accident due to the deplorable condition of the rail line was forthcoming. Work has occurred to improve this section of rail that is meters away from numerous buildings. However, additional improvements are necessary for obvious safety reasons. Question to the Minister: will the Minister update the members of the House with regard to yesterday's derailment in Stellarton, where 2 rail cars loaded with carbon black landed in someone's backyard?
The Honourable Minister of Municipal Affairs.
Thank you, Mr. Speaker. I am aware of the situation. My understanding, they have not reached out to EMO, but we are aware, I guess through the media reports actually is the only thing that I can say on that we've read, that they have cleanup underway. We would expect as EMO or as government that would be done, and they seem to be doing that, and stated at the same time that there was no hazard to the town or to humans there. Thank you.
The honourable member for Pictou Centre.
Mr. Speaker, there's been at least 4 train derailments in Pictou County since 2014, one of which required an evacuation of residents after 6 containers carrying a butane-propane mix left the track. The rails near Riverbank Street in Stellarton have been a safety concern for some time. Trains are expected to travel 10 kilometres throughout the community. Even at that speed, it remains risky. My question to the Minister, does the Minister know if a cause has been identified?
The Honourable Minister of Municipal Affairs.
I can say at this time, Mr. Speaker, I'm not aware of why that happened. I've not been advised on that. I do know the area very well, as the honourable member would know, and do know how busy it is through there and has been over many years. Not quite as busy these days as it has been in the past. The other piece of that, each municipal unit, as we would know in this House, Mr. Speaker, and around the province is responsible for putting together an emergency management plan should something happen, and we as EMO are certainly there to assist whenever required as well. So again, I'm not aware of the cause of the incident, but hopefully we'll have some information in the days ahead, if not sooner, Mr. Speaker. Thank you.
The honourable member for Sackville-Beaverbank.
Mr. Speaker, my question today is for the Minister of Education. On the 27th of September, the Minister announced a $1.9 million additional investment in stock transportation to address arrival times of students. Since September the 5th, one bus in my constituency has arrived at school between 20 minutes and a half an hour late each morning and continues to do so. This is the accessible bus that carries students with a variety of needs who have now missed a total of 10 instructional hours since the school year has started. There have been many calls from my office to stock, but this hasn't been rectified yet. Does the Minister believe that it is acceptable for this bus to be late, given that school has now been in for over a month?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker, and I appreciate the member bringing this issue to my attention. Our expectation, which we made very clear to the region and to Stock, is that our students get to school on time and be returned on time and safely. If that is not happening, specific cases, I do appreciate the members informing me so we can take a look at those individual cases as they arise.
The honourable member for Sackville-Beaverbank.
Yes, and I thank the Minister for that. I will, Mr. Speaker, I will provide the bus number perhaps later on so that it can be looked into further. Mr. Speaker, for a long time, the Minister stated that 98% of the students getting back and forth to school on time was good. Last month, the Minister stated that one of his first issues at the new Provincial Advisory Council on Education would be to deal with busing. This is the same announcement that added the $1.9 million to busing. I'm left, however, what role the PAC will be playing, given that the fact that the announcement came out even before the committees met. But my real issue here today is the students. Can the Minister please tell the House how much longer parents and students have to wait before busing problems will be fixed totally in the HRCE? Thank you.
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. To clarify, we did announce interim measures, which was the $1.9 million, 37 new buses to focus on the pressures we have from courtesy busing requests and those with disabilities. However, we also announced throughout the course of the rest of the year we'll be doing an overall evaluation and report on busing in the province. We'll be working with SACs directly. We'll be working with our principals. We'll be working with our frontline workers, the unions, and the bus drivers. And we'll also be working with the Provincial Advisory Council to get feedback from them. We've got folks that are previous board chairs on that committee. And I know that their insight will be as valuable to this process as anybody else's. Thank you.
The honourable member for Sydney River Myra Lewisburg.
Well, thank you very much, Mr. Speaker. And my question through you is to the Minister of Health and Wellness. Mr. Speaker, a white elephant is in modern usage is known as an object, building project, or scheme, business venture, facility considered expensive but without any value. Nova Scotia needs new medical facilities, and nobody will argue with that. But what it needs more, Mr. Speaker, and what it needs sooner, are doctors, nurses, and medical professions who provide patient care. A new hospital without doctors heals no one. An emergency room without an ambulance coverage saves no one, Mr. Speaker. So the question is quite simple. Now that they've announced all the building projects, will the minister please focus on doctors and nurses and not the bricks and mortar? A simple yes or no will do.
The Honourable Minister of Health.
Thank you, Mr. Speaker.
Order, please. The Honourable Minister of Health.
Thank you, Mr. Speaker. In fact, I'd like to advise through you to the member opposite, Mr. Speaker, that in fact this isn't an either-or question. The fact of the matter is we have and we will continue to focus on both the people who deliver our health care on the front lines, Mr. Speaker, as well as ensuring that they have the tools, the technology and the infrastructure that they need to deliver that care for Nova Scotians from one end of the province to the other for tomorrow and well into the future.
The Honourable Member for Sydney River, Myra, Lewisburg.
Thank you very much. Well, Mr. Speaker, I got to tell you, this government reminds me of the movie Field of Dreams. They believe that if they build it, they will come. But I don't believe that. Mr. Speaker, we need all kinds of, and I've heard all kinds of stories that state how bad health care is in this province. We've heard about 5-hour car rides for a 5-minute appointment in Halifax. We've heard of cascading ER closures. We've heard of people dying while they wait for the services their tax dollars are supposed to pay for. It's not the buildings, Mr. Speaker, it's the lack of staff. The government says they're redesigning these buildings for healthcare for the next 50 years. The question, will the architects design these hospitals with hallways that are wide enough for the gurneys so that the health care of this government will stay the same as it's been providing all the time? Hallway health care.
The Honourable Minister of Health.
Thank you, Mr. Speaker. I guess in response to the member's question and information in his preamble, Mr. Speaker, I direct him back, in fact, to his previous question to the Minister of Transportation Infrastructure Renewal. If I recall that preamble correctly, he made some statement effectively about how important the investment in infrastructure was to attracting and supporting our frontline healthcare professionals, Mr. Speaker. So I'm a little bit confused by the questions the member's bringing here and the inconsistency of what he's bringing to the table at the floor of this House, Mr. Speaker.
Order, please. The Honourable Minister of Health. The Honourable Member for Cape Breton, Dartmouth South.
Thank you, Mr. Speaker. My question is for the Minister of Business. In a week, recreational cannabis will be legal in Nova Scotia. Cannabis production is an industry that is growing exponentially and will grow more. Unfortunately, compared to other provinces, we're sorely behind on developing local cannabis production. This year, the NSLC will be importing over 3 million grams of cannabis. That is a multi-million-dollar missed opportunity for rural Nova Scotia, which has the capacity and agricultural expertise to fill this gap. Our government has recognized the value of focused supports to develop local wine and beer, but nothing for local cannabis production. My question is, what is the minister doing to ensure that the NSLC's cannabis procurement shifts quickly to supporting local jobs and the rural economy? Surprise, we care about the economy.
The Honourable Minister of Justice.
Thank you, Mr. Speaker, and I thank my colleague for the question. Nova Scotia Liquor Corporation has been public on this very issue, Mr. Speaker. The production of recreational cannabis and the licensing of those producers is the responsibility of the federal government. We know, Mr. Speaker, that there are a number of Nova Scotia business entities who are part of that process. As we speak, Mr. Speaker, 3 Nova Scotia companies have been approved licensed for production. They continue to work in that process with Health Canada to secure their retail license, Mr. Speaker. But the remainder of those Nova Scotia businesses continue to compete with Health Canada to ensure that Nova Scotia product is available into the future.
The Honourable Member for Dartmouth South.
Thank you, Mr. Speaker. With respect, my question was about provincial incentives, not federal licensing. Mr. Speaker, we know that in 2019, recreational edible cannabis products will also become legal. We know that in Canada, 6 out of 10 cannabis consumers will likely choose edibles. This is another inevitable development that will either be an economic opportunity for Nova Scotians or another imported expense. Mr. Speaker, my question to the minister is what is he doing to make sure Nova Scotian entrepreneurs have the information and support they need to be ready for the recreational edible cannabis market?
The Honourable Minister of Justice.
Thank you, Mr. Speaker. And this is a discussion that has been ongoing, Mr. Speaker, with the producers that have stepped up to the plate, Mr. Speaker, to drive the business and the economy of Nova Scotia in this new field. But with respect, Mr. Speaker, Nova Scotians are not limited to the retail sale within the province of Nova Scotia. These exporters, these producers, Mr. Speaker, are looking beyond Nova Scotia borders. They're looking to export Nova Scotia product quite literally around the world, Mr. Speaker. So Nova Scotia, Mr. Speaker, as this process continues to unfold, we will see Nova Scotia producers who are licensed to sell retail cannabis, and it will not only be available within Nova Scotia, Mr. Speaker, to the Nova Scotia Liquor Corporation, it will be available outside of the province and the country.
The Honourable Member for Victoria and the Lakes.
Thank you, Mr. Speaker. Mr. Speaker, this government promised a doctor for every Nova Scotian, but there are over 100,000 Nova Scotians who are either on government wait list or have just given up their search altogether. Mr. Speaker, for these Nova Scotians, access to our healthcare system means long waits at emergency rooms and no continuity of care because they're dependent on walk-in clinics. These Nova Scotians deserve better. Last week, the minister took issue when I said Nova Scotian doctors are paid $100,000 less than doctors practicing in Prince Edward Island, according to Doctors Nova Scotia. So my question to the Minister of Health is, could he inform this House how much more Nova Scotia family doctors are paid compared to those at PEI in New Brunswick?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I believe, just to clarify the response that I made last time, in case there was any confusion by the member. In fact, if I recall correctly, what I was stating was the numbers that he was bringing to the floor of the legislature were outdated information. He failed to take into consideration or recognize the almost $40 billion investment that we made to improve compensation for comprehensive family care practices, as well as incentives for family physicians providing that comprehensive care to take additional patients on the family roster. Thank you.
The Honourable Member for Victoria the Lakes.
Mr. Speaker, this government's doctor recruitment strategy seems to have been drawn on the back of a napkin. My constituents are concerned with the recent departure of Dr. Emily Beaton that I mentioned last week due to the lack of work-life balance she was promised by this government. New recruits may think twice when accepting an offer from this government because of the stories they've heard from their peers on how they're respected and treated. When asked last week, the minister bragged about the new doctor they recruited for my constituency. So my question to the minister is, if one doctor leaves while another doctor comes, how does that fix the doctor shortage in my constituency?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And the member may think that it doesn't make an impact, Mr. Speaker, but indeed, for every physician or a frontline healthcare worker that we're adding to the system through recruitment.
Order, please. The Honourable Minister of Health.
Through recruitment initiatives, Mr. Speaker, new initiatives that we've brought in, whether that be our tuition relief program, Mr. Speaker, our new immigration stream, which is the one that resulted in the physician that I referred to last week in the members' community, Mr. Speaker, whether that's the expansion of our collaborative care practices and the fact that government's hiring nurse practitioners, family practice nurses, social workers, other therapists to support frontline health care providers and to provide care for all Nova Scotians. Mr. Speaker, that member may not think that this is important for the health care of Nova Scotians, but we do.
The Honourable Member for Northside Westmount.
Thank you, Mr. Speaker. And Mr. Speaker, I think the new math initiatives in schools should be taught to the Minister of Health. One leaves, one comes. That's not new recruitment. Mr. Speaker, the government has no idea what they're doing when it comes to healthcare services in Cape Breton. Time and time again, I've risen in this House on behalf of great people in Northside Westmount to bring their healthcare concerns to the floor of the legislature to a tone-deaf government. I've highlighted the issues facing our people.
I'd like to ask the Honourable Member to retract his statement indicating the Honourable Minister should take a course. I'll take that as a personal insult. The Honourable Member for Northside Westmount.
I'm sorry, Mr. Speaker, I'll retract that statement. The Minister boasts about how this new facilities in Cape Breton will attract a slew of new healthcare professionals, from doctors to nurses and everyone in between. So my question to the Minister, if this is really the case, why are travel nurses being used at the Cape Breton Regional Hospital emergency room when they've essentially closed down 2 emergency rooms in Cape Breton already?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As the member would know, in fact, his colleague earlier today in question period highlighted just that point that I've been making, which is that the new investment in infrastructure is actually an important component for frontline healthcare providers when they are operating. Mr. Speaker, the member from Sydney River, Lewisburg, Myra Lewisburg, made that reference, Mr. Speaker, in a question earlier today when questioning the Minister of Transportation Infrastructure Renewal.
The Honourable Member for Northside, Westmount.
Thank you, Mr. Speaker. Mr. Speaker, it's been brought to my attention that travel nurses are being brought in from as far as Vancouver to work at the Cape Breton Regional Hospital emergency room. Mr. Speaker, I appreciate the work these nurses provide. However, I'm worried that this Band-Aid solution that is costing taxpayers more money because of travel expenses, lodging, and the nurses are allegedly paid a lot more money than our regular nurses. Now, I know Nova Scotia's health authority is not worried about taxpayer money, Mr. Speaker, given the recent hospitality scandal, but I am, and so are my constituents. So my question to the Minister is, if we need to bring in travel nurses to provide care in the Cape Breton Regional Hospital, what is the Minister doing to train and attract our own nurses right here in Nova Scotia?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I'm pleased to advise the member that I've taken the time to actually get out and, as part of meeting frontline healthcare workers, I thought it was important, Mr. Speaker, to also get out and meet the students, our future, our next generation of healthcare workers. I met with nursing students, Cape Breton University, St. Evac, as well as Dal nursing students in the Yarmouth location, Mr. Speaker, and hearing directly from these students in our nursing program, Mr. Speaker, they're very excited about the opportunity that await for them upon graduation. And Mr. Speaker, we do hire those nurses in our province for those that choose to stay here. And in addition, Mr. Speaker, in the nurse practitioner space, which is an advanced level of training for nurses, Mr. Speaker, can provide more frontline care, primary care. We've added additional seats to our Dalhousie program and introduced a compensation program to help support those who want to take it.
The Honourable Member for Sydney River, Myra, Lewisburg.
Oh, thank you very much, Mr. Speaker. And my question through you is to the Minister of TIR. Mr. Speaker, a media story last night indicates that Bay Ferries are rumoured move from Portland to Bar Harbour is well on its way to becoming a reality. And according to the news story, the move will bring with it significant costs for both the company and taxpayers, including millions of improvements to the Bar Harbour terminal. The report says that taxpayers will also be on the hook for a $1 million guarantee of the new lease. So my question for the Minister is, will the Minister update the House about what the plans are for Bay Ferries next season?
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker. And I'm very pleased to rise and inform the House and the people of Nova Scotia that though we don't have the final results of this year's traffic on the Nova Scotia ferry, we're very optimistic that it's going to set a new record for Nova Scotia. And we are so happy for the people, all the people of Nova Scotia, but particularly the people of Southwest Nova Scotia and their tourism industry that is thriving as a result of this fine piece of work.
The Honourable Member for Sydney River, Myra, Lewisburg.
I believe, Mr. Speaker, that's what you call a paid political announcement. Mr. Speaker, the question was, what exactly is the cost to the people of the province of Nova Scotia? We're all happy for them. We just want to know what the cost was. The Progressive Conservatives Caucus Office has submitted a FOIPOP request to unveil the management fees for Bay Ferries, which it receives, and this has been in the process for almost 2 years. And that request is still making its way through the system, Mr. Speaker. We believe taxpayers should know what their money is being spent on. So will the Minister commit today to making public any improvements or other costs taxpayers will be responsible for if Bay Ferries makes the move to Bar Harbour? And we know that the Nova Scotians will be happy wherever the ship is coming from.
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker, and thank the member opposite for the question. I think, Mr. Speaker, this is a classic case of the glass being half empty or half full, because we don't look at this as a cost. We look at it as an investment, a good investment for the people of Nova Scotia that supports our tourism industry, supports all of our economic development, including Cape Breton, because many of those people find their way down to the beautiful island of Cape Breton when they're here for tourism business, and they spend a lot of money in the economy of this province, Mr. Speaker. Thank you.
The Honourable House Leader for the New Democratic Party.
Mr. Speaker, the government has dropped the ball once again, Mr. Speaker. They've really dropped the ball on a very important issue, Mr. Speaker, that I think is a serious issue that we need to make sure that we have the appropriate amount of time that they address this serious issue, Mr. Speaker, when they drop the ball here in Nova Scotia.
Order, please. Time allotted for oral questions put by members to ministers has expired. We'll now